My name is Dr. Brian Harper. I'm serving as the Chief Medical Officer for New York Institute of Technology, and I would like to discuss with you this afternoon issues pertaining to the new disease called COVID-19. COVID-19 was a disease that was actually discovered in Wuhan City in China in late 2019. And since that time, now we have a number of cases that have actually spread throughout the world. I would like to talk a little bit about the virus itself that causes COVID-19, which is the disease, as well as to spread some basic information in an attempt to really reduce fear and anxiety that may be associated with this disease. Obviously, this is a new disease entity that's caused by a virus, and it's communicable, which means it can be transmitted from one person to another. So you can understand that there's a worldwide concern about this disease and its potential to cause a lot of problems throughout the world. However, if we have an understanding of the virus, how it's transmitted, and things of that nature, and ways in which we can actually prevent the virus from entering our bodies, that may help everyone feel just a little bit better and not be overly concerned or overly panicked about a situation that we are currently in. So let me start off with talking a little bit just in terms of the number of cases. So we've all heard that at this point, there are over 94,000 cases worldwide, with 3,200 deaths. But to put that in some perspective, remember we have a very large population worldwide. There are over 7 billion people worldwide. If we look at the situation in the United States, we have over 100 cases, but again, we have 330 million people in the United States. That's our population. So relative to the number of people that we have, you can see that the number of cases is still fairly small. The same thing goes for New York State, in which we currently have roughly about 11 cases, and there are over 19 million people in New York State. All of this is just to say that, you know, we have to keep things in perspective when we hear sometimes that there are 3,200 deaths worldwide. It may sound like a very large number, but in the public health arena, we also always look at what we call the denominator. So what's the total population that we're dealing with, so that you can see that if there are 3,200 deaths worldwide and 7 billion people, it sort of just puts things in some perspective. So now let's talk a little bit about the virus itself that causes COVID-19. So COVID-19 is the disease entity. The virus which causes COVID-19 is actually called SARS-CoV-2, and I'll describe that a little bit more as we move forward. Essentially, coronaviruses are a class of viruses that are called coronaviruses because the word corona is suggestive of the word crown, and if you were to look at the virus under a microscope, you would see a number of crown-like outgrowths, which is why they call this class of viruses coronaviruses. It's a large family of viruses that actually are found in a variety of animals. We're talking about cattle, camels, cats, as well as bats. And in essence, there are generally 7 human coronaviruses. So there's 7 known viruses that affect humans. There are 4 viruses which actually cause the common cold. So coronaviruses were known within the medical and scientific community as early as the 1960s. But when we were taught, when I was in medical school, it was really these are the viruses that cause the common cold. Later on, it became apparent that some of the viruses may have mutated and began to cause diseases which were a little bit more severe than the common cold. They were really causing a lot of respiratory distress. So you may recall at one point there was a new disease called MERS, which was the Middle Eastern Respiratory Syndrome. And again, that caused more respiratory distress than the average common cold. And later on, there was another disease called SARS, which was severe acute respiratory syndrome. And that was the first coronavirus. So when we talk about SARS, that was the first coronavirus. Now there's a SARS coronavirus 2, which is causing the current epidemic that we're dealing with throughout the world, which causes ultimately COVID-19. So what do we know about SARS or coronaviruses in general? So once you hear that a disease is caused by a virus, that should put you in a certain frame of mind. Number one, there are no cures for any viruses. So the best thing that you can really come up with is a vaccine for a virus. So you may be more familiar with the flu virus, in which we've developed a vaccine. And every year on an annual basis, we encourage people to receive an updated flu vaccine because as the virus itself mutates, we change the vaccine and we encourage people to be vaccinated. When a person is vaccinated, it's to sort of boost their immune system so that when they come in contact with the real virus, the body is more prepared to help fight it off and prevent any major disease entity. Unfortunately, since SARS coronavirus 2 is so new, we haven't had an opportunity yet to develop a vaccine, and that is what is currently being worked on. So having said that, once we know that it's caused by a vaccine, the other piece is that vaccines, there are no cures for any vaccines, so there are no pills or medications that you can take to kill a virus. However, there are things that you can do to prevent coming in contact with that virus. So the take-home message is that things such as antibiotics will not kill a virus. Antibiotics are used for bacteria. So there is no antibiotic that you can take for this particular virus. However, we happen to know that the SARS virus belongs to a class of viruses which are called enveloped viruses. And why is that important? There are essentially three categories of how you evaluate the fragility of a virus. One is that it's enveloped. The other is that it's a larger virus and it's non-enveloped. And then there's a smaller virus which is non-enveloped. The most fragile of all three categories are the enveloped viruses, which is the category coronavirus 2 belongs to. So that's actually good news. So we know that the virus itself is sensitive to acid and heat and to potentially drying out, which will reduce its infectivity. So that's very good news. We also know that the virus can be killed with routine disinfectants. 0.1% bleach will actually kill a virus. You can see that there's a number of recommendations for hand washing. So soap and water will also kill the virus, as well as alcohol-based sanitizer. So any hand sanitizer that's 60% alcohol will also kill the virus, which is very good news. One of the areas that people have raised a lot of questions about is also the use of masks to prevent them from becoming infected. And one mask that is routinely discussed are really called surgical masks. So that's what a surgeon would wear when they're performing surgery. Surgical masks have their role in the healthcare arena in that if a person comes in and they're very ill, they're sneezing or they're coughing, we recommend that that individual puts on a surgical mask because it prevents them from spewing organisms throughout the environment. So that's a very important role. However, that surgical mask does not prevent organisms from going the opposite direction, going into someone's body. So if you're a healthy person and you put on a surgical mask and you're in an environment where you have the SARS coronavirus, that will not necessarily protect you. There are different types of masks that will protect you as far as inhalation of a given virus or given organisms, and those are actually called N95 masks. So those are fitted masks, so you have to be fitted for that. It has to be designed so that no air can get in through the sides. But the regular surgical mask will not necessarily prevent the virus from getting into the body. So I think that's very important because that's a question that's always raised is, well, maybe I can wear a surgical mask in order to prevent myself from becoming infected with with the coronavirus. So let's talk a little bit about some of the signs and symptoms of coronavirus. Right now, basically, we're still in the process of learning more and more about the disease, but there's an understanding that the incubation period, or the time from infection to when a person becomes ill, tends to be roughly 14 days. So you may hear the recommendation that if a person has been to an area where we know the virus is circulating, the individual is quarantined or put in isolation for 14 days because we know that that's the median time period in which if the person does not show any symptoms, the chances are they're not infected. So that's where that's sort of coming from, that incubation period. What we also know about the disease is that when people become ill as a result of the disease, it tends to be because they may be older, or they may have other chronic diseases. So if they have problems with their lungs and their heart and other chronic diseases, they may be slightly more fragile, and they are more likely to become very ill as a result of the SARS coronavirus 2. The good news is that roughly 80% of people even if you're exposed to the virus, 80% of individuals will have mild symptoms, and for the most part will not be very ill at all, which is a very good, it's a good sign to some extent, because we know that it's not a virus like many other viruses or other bacteria that has a very high case fatality rate. In the case of SARS coronavirus 2, we're looking at a case fatality rate of roughly 1%, maybe 2% or so. So that's the good news regarding the virus. However, again, if you're very ill, it can certainly take its toll. And we're still learning as we move forward more and more about this particular disease. Some of the symptoms that a person may actually have if they were to encounter this disease includes things that are very similar to the common cold. Remember, the human coronaviruses that are not SARS or MERS, they have symptoms that are related to the common cold. So things such as a runny nose, a sore throat, coughing and sneezing. In the case of SARS coronavirus 2, a big concern would be if you have trouble with shortness of breath and difficulty breathing. Those are some of the signs that a person may be dealing with something more significant than just a common cold. In addition to that, if a person continues to become ill, then they may have things like, certainly may have a fever early on as well, and a headache, but then they may also deal with things like a pneumonia, or what we call acute respiratory distress syndrome, in which the lungs become filled with fluid and makes it very difficult for the person to get oxygen into their bloodstream. So then they would develop low oxygen in their blood, and they can also cause some cardiac problems as well. One of the symptoms that are fairly that is specific for this particular disease is that sometimes some individuals may also develop diarrhea, in addition to the routine flu-like symptoms. So as I mentioned, the important piece is that 80% of people will have mild symptoms, and this is based on the information that we have so far. And the case fatality rate is roughly maybe between 1% and 2%. Now, bear in mind that case fatality rate is still higher than what we see in the regular flu virus, which is what is causing some of the concern. The current concern would be that even with that low case fatality rate, it could still cause quite a number of deaths if, in fact, this virus were transmitted throughout the country. So that's some of the public health concern, but we have to watch and see exactly where that goes. So at this point, I'd like to sort of change gears a little and talk a little bit about some of the things that we can do to actually prevent the virus from causing problems within the community and prevent ourselves from being infected. As I mentioned earlier, there are no cures for any viruses. So this is a category of things that we can do that are called non-pharmacological interventions, or NPIs. So these are actions that people in communities can take to help slow the spread of this respiratory virus. These are the things that we should probably be practicing on a routine basis and not really wait for a major new virus to come along. These are things that we can do to prevent viruses in general and other bacteria from causing problems in the community. So some of the things that we're going to look at are called personal NPIs. So these are measures and things that we can do on a routine basis that an individual can do to prevent the spread of the virus. So the first thing that we start off with is really voluntary home isolation. So if you're feeling ill, you're at home, you're coughing, you're sneezing, and you just don't feel well, the first thing that we can do to prevent spread within the community is for that individual to just remain at home and to limit their access to other individuals. So you don't want to spread something that you may have to other people. Oftentimes we try to be troopers and we want to come to work and we may have a lot of work to do, or if you're in school you may have a lot of schoolwork to do, but sometimes it is important to take a sick day or to remain at home to benefit the other community, as well as to rest and improve on your own situation. Then we also have what we call a respiratory etiquette. So this is if a person coughs or sneezes, just like your mother and your grandmother probably told you to cover your mouth when you sneeze, the same recommendation holds true today. The only thing is that we're saying that you shouldn't really use your hand to cover your mouth. You should probably use a tissue if you have one available, or the inside of your shirt sleeve. So you would cover your mouth in this fashion in an attempt to prevent, as I mentioned, the spread of any organisms throughout the environment. And then at that point, you also want to avoid touching your eyes or your nose or your mouth, because that's how the virus can potentially be transmitted. Whether you shake someone's hand or you touch something that's infected, and then you manage to touch your eyes or your mouth or your nose, then the virus will gain entry into your body. And that's why we recommend strongly hand hygiene. So this is making sure that we wash our hands on a regular basis throughout the day using soap and water. Soap and water is fine to wash your hands for roughly 20 seconds or more. And if there is no soap and water available, then we recommend the alcohol-based hand sanitizer. So that's going to be a hand sanitizer that has 60% alcohol, is effective, again, in terms of killing this virus and reducing the likelihood of transmission. So again, those are some of the things that you can do personally. We discussed a little earlier the use of face masks, and currently the Surgeon General is actually urging people to refrain from buying face masks so that they're available to the healthcare community. And as I mentioned earlier, the surgical face mask is not effective in preventing the virus from gaining entry into a healthy person who's wearing a face mask. It's more important for a person who comes into, let's say, the healthcare arena, health center, and they are coughing and sneezing. They will certainly be given a mask to prevent them from spewing organisms throughout the waiting room, and they will be put in isolation to prevent them from, again, coming in contact with other individuals. So again, these are all personal protective measures that can be used. And then there will be broader measures that can be used, so that if you know that someone is infected with a given disease, that's when there's discussion about closing schools and closing facilities. And those decisions are made obviously at a very high level, where the health department, the local health department, and potentially the Centers for Disease Control, as well as the state health department, will be all involved with doing an investigation, doing an assessment, and making a determination based on the number of cases, if people are very ill, as to whether or not you would actually close a school, and or if you would close any other business facilities. So rest assured that we work very closely with all of the departments that were mentioned, the health departments, in terms of making these decisions, and we'll do obviously what's in the best interest of our faculty and our students, as well as our staff, to make sure that everyone remains healthy. I would like to conclude with saying that despite the fact that we do have this particular virus, which is of some concern, we really are still in a position in which there are things that we can do to prevent ourselves from becoming infected, and we have to understand that we do have an immune system. So Mother Nature has blessed us with an immune system, understanding that we were born into an environment with microorganisms. So all of the things that we recommend in terms of remaining healthy in general, exercising, eating properly, getting enough sleep at night, all of those things help to boost your immune system, so that if you come in contact with this virus or any other virus, you have the ability to fight it off and to remain healthy. And as you can see from the early data, roughly 80% of people fit into that category, where they may have some mild symptoms and they can move forward and survive this disease. So having said that, again, I would hope that you would use some of the information that we've shared here and make wise decisions. If you're feeling ill, certainly remain at home, and feel free to contact your healthcare provider or us over at the health centers if you need any further advice. Thank you.